Hey guys, this is Dr. Samir Islam. I want to thank you for joining me tonight. And so tonight we're going to talk about a topic that a lot of people ask me about, which is constipation and basically how to help out with your bowels. There's a lot of people who have issues with constipation, whether it's having difficulty using the restroom or not going to the restroom as often or just straining whenever you use the bathroom. And they're wanting to know what they can do to help figure out kind of what's going on. So tonight's video, I'm going to tell you just how exactly you can poop better. And so this is one of the most common complaints that I see as a physician, and I'm sure it's a common complaint that people have in their everyday lives. And whenever you're having constipation or you can't poop, it can lead to a lot of other issues within the gut, whether it's problems with bloating, hemorrhoids, pain in your abdomen, pain in your bottom, just pain everywhere. Now, before we talk about exactly how to poop better, I want to tell you what we consider a normal poop. And so we use this scale called a Bristol stool scale. This is a scale that we have in the GI world to help us determine whether you're actually constipated or having diarrhea or not. And so we have this scale from 1 to 7. And this is what we use as a visual guide to allow us to determine what is normal and what is not normal. I have a lot of people who ask me, are my bowel movements normal, or is it normal to have this type of bowel movement? And if you use this scale, you can actually see if that's the case. So if you look at the scale, type 1 and type 2 are considered constipated. And that's when you have very large, very hard stools that are very lumpy-like, and then scale 5, 6, and 7 are the ones that are on the more of the diarrhea side. But whenever you have type 3 and type 4, this is considered, in my opinion, the golden poo. This is what we know is the best poo that you can have. It's the standard that we have for patients who have a normal bowel movement. So if you're worried about you being constipated or having normal bowels, if you have a stool of 3 or 4, consider yourself one of the lucky ones to have a normal bowel movement. But when we think of constipation, we think of that Bristol stool scale of 1 to 2. And when we think of diarrhea, we think of 3 to 4. And so 3 to 4, I consider the golden poo. That's the magic poo that we all strive for. And when we consider Bristol stool 1 to 2, that's more of the constipation side. So here are my tips on how to poop better. Number 1, avoid fried food. I can guarantee you that the food that you eat, especially if it's fried food, is making tremendous problems in your gut. It's probably causing a havoc, including causing constipation, reflux, maybe even diarrhea. The issue with fried food is that it just takes a long time to digest, and the more grease and fried food you have in there, the longer it's going to stay within your gut, and because of that, it's going to cause you to have more and more constipation. In addition, we do find the change in the gut microbiome because of the fried foods that people eat, and that can make things a lot more difficult for a lot of patients to have as well. Whenever you're having fried foods and you're changing the gut microbiome, it's causing a huge difference in terms of what your normal gut flora should be. So the first thing I would tell all my patients is avoid fried foods. It's a very important treatment option that we have for our patients who have that. And we know that when you look at clinical studies, foods that are high in saturated fat, those tend to cause increasing constipation as well. The second thing you may want to consider is try to eliminate certain sugar alcohols. These include things like xylitol, mannitol, and sorbitol. These are sugars that are not natural. They're artificial sweeteners that are found in either gums, candy, diet drinks, or you may actually put them in yourself in certain coffees or drinks. What we know about these sugar alcohols is that the body can't digest these normally, and so it causes a lot of bloating and fermentation and problems like that. And so this can cause gas to occur and cause bloating and constipation to get worse as well. And so if you notice yourself getting more and more constipated, try to eliminate these sugar alcohols. If you just look on the back of the foods that you eat or the drinks that you have and seeing the ingredients for there, if you see terms like xylitol, mannitol, or sorbitol, this actually may be the reason why you're having some constipation as well. Minimize alcohol. I know this is easier said than done, but I can tell you that alcohol tends to change digestion pretty dramatically. The other important thing that alcohol does is that it will cause you to be dehydrated. So by being dehydrated, it will make your stools harder, firmer, and more difficult to use the restroom. Dairy can be a significant problem for some people, not for everyone, but for some people. You may notice more and more GI issues whenever you're having dairy products such as milk, cheese, or yogurt. So if you notice that, you actually may be lactose intolerant, and that problem could be an issue that's easily dealt by eliminating dairy. I have a lot of patients who have a lot of GI issues who are just lactose intolerant, and so by avoiding dairy products, Try to avoid milk, yogurt, and cheese, and seeing how you feel. You may notice that your constipation getting better and your bowel habits improving as well. Gluten can be a problem for some people. Now, this is not universally for everybody. Not everyone is gluten intolerant. Not everyone has celiac disease, but there are a subset of patients who have some gluten intolerance or just don't feel well with gluten. So if you notice yourself eating a lot of fried food, a lot of breaded food, and you cut out that breading, you may notice yourself feeling better, and that actually may be the problem itself right there. So just make sure I would just try to experiment, just seeing how you feel by eliminating or minimizing gluten. See if that makes you feel any better or any worse. And if you are worried about getting formal testing for celiac, certainly make sure you speak to your healthcare provider to see if you actually have that autoimmune condition. So I'm really curious to see what's worked for you. Have you had issues with constipation? Have you tried doing some of these diet changes, and have they made any difference? What tips have worked for you? I would love for you to comment below, and if you can let us know what has worked for you as well. But these are the tips I recommend for my patients who may be suffering from constipation. Try to avoid fried foods. Try to eliminate sugar alcohols. Minimize alcohol. Try to eliminate dairy. And try to minimize gluten, just seeing how you feel. Making these simple changes alone can hopefully make you feel a lot better, address your constipation, and take care of your GI issues.